Chad, it's Medical Monday with our hospital experts at East Cooper Medical Center. Today we're talking about knee pain, and I need to talk a lot about that, and when to seek help. Jennifer Main from the East Cooper Outpatient Rehab Center is joining us. And speaking of rehab, what is usually the day in the role, the life of a rehab individual? I mean, you guys got to know all kinds of parts of the body, what extremities that you're dealing with, all of this, and just how far you can go with rehab. And, you know, sometimes it's one of those things, no pain, no gain, really.
That is the case a lot of times, but it's not always the case. Okay. Sometimes we want to keep people out of pain while they are rehabbing, especially post-operatively. But it is very true. Sometimes we have to put people through pain in order to help them.
Yeah, but it's a matter of when someone is a rehab expert and they're getting into that, they're really trying their best, working with the patient to get the patient back to where they normally were after an injury or an operation or something like that, right?
Absolutely. That's always our goal. Always our goal. I kind of think of the role of PT as we're almost, at least in the orthopedic section of our clinic, we're kind of movement detectives. Yeah. You know, if somebody comes in with knee pain, it could be a tendon issue, it could be a ligament issue, it could be a bursitis issue, it could be the fact that your kneecap is gliding incorrectly in the groove that it's built for. It could be a weak hip that manifests, as knee pain. So there are a lot of different things that
you got to find out what the source of it is, because with your knee pain, it may be a lower back problem that's causing that knee pain because you're trying to correct it. So you guys are a blessing to people who have all sorts of pains. But today we're talking about knee pain. What is the most common knee pain that you see at East Cooper that you take care of?
The most common one that we see in our clinic is actually a joint replacement. So people know they have knee pain when they come in with that, certainly.
Oh, heck yeah.
But we do see a lot of what I was mentioning, the patellofemoral pain, which is where the kneecap isn't gliding correctly in the groove of your thigh.
Okay. And when you go through that physical training, how long roughly does it take for, I mean, because I've heard some people get knee replacement and 3 months later they're running a marathon, which is probably not the normal case.
There is a saying that we use in the clinic every day: just because you can doesn't mean you should. We use that pretty much every day. But there isn't really everybody comes in for a month, or everybody comes in for 6 visits. Sometimes people will come for 1 visit just to learn the exercises to help themselves. Sometimes people will come 3 times a week. Insurance is changing the way we practice too, because if someone has 15 visits a year, it puts more on the patient, and we take that into account, and we'll create their rehab program with that in mind.
Say I had right knee replacement, because right now I got bone on bone, and sometimes I can hear it grinding. So I have complete knee replacement. Okay. And the next day, my doctor, or that afternoon, my doctor says, you need to go see these folks. And I come in and I see you. What can I expect from then on?
Well, first of all, again, we keep using the joint replacement example, which is fine. But if you did have a joint replacement, typically you'd come in about 3 days post-operatively, not the next day. Okay.
Get me straight on that. There we go.
I'm good with the details.
Yeah.
But what we would do initially is you would fill out a medical intake form. We'd get your medical history. We would take baseline information of your other leg, because again, we want to get you back. We're going to do baseline information on the other leg, baseline information here, and then start you on a proper exercise program from there.
What other type of services do y'all provide?
I am really glad you asked that question, because I am the day-to-day supervisor for our clinic. We do have 4 orthopedic surgeons right next door to us in our office building, so we do see all things orthopedic. Lots of knees, lots of shoulders, hips, ankles. But we also are, I think, the most comprehensive clinic in Mount Pleasant. We offer OT, speech, and PT under one roof.
Oh, wow.
So if someone has had a stroke or Parkinson's or anything neurologic, it's really nice to have those 3 services available in one spot. I have a therapist in our clinic who has specialized training in vertigo. We have a therapist who has specialized training in female incontinence and pelvic pain. I have a certified lymphedema therapist, and I know those are terms and topics that lots of people don't know. Lymphedema, your lymphatic system filters filters waste products out of your system. If someone has had breast cancer and they've taken lymph nodes, they've taken out some of that filtering system. So Rachel's trained in a specialized manual therapy technique that can help manually drain some of those waste products out of your system. And then there's some wrapping techniques and things that go along with that. But we also have a therapist who has a passion for treating scoliosis. We have a therapist who tailors most of her exercise programs toward Pilates-based rehab. So we treat really just about everything but the spinal cord injuries. So we have a very comprehensive clinic.
You guys have the experts that people need.
Absolutely.
No doubt about that. East Cooper Medical Center. Thank you so much. Where exactly are you guys located?
We are at 851 Leonard Fulgham Drive in the Mullis building right next to East Cooper Hospital.
Thank you so much for joining us
Thank
today.
you.
Appreciate it. And don't forget to visit the abcnews4.com/experts for more information from our hospital experts. We're back in a moment with Low Country Live and finally getting organized. I got to get myself organized. Stay with us.